Hi, it's Nurse Cathy, and it's time for 5 on Fridays. Well, arthritis is a general term that refers to joint pain or joint disease. Now, there are over 100 different types of arthritis. Now, arthritis can affect people of all ages, all races, all sexes, but it's most common among women, and it's most common among people as they age. Now, more than 50 million adults and 300,000 children have some form of arthritis. Yes, children have arthritis also. Arthritis is also the leading chronic condition that causes disability. Now, some of the common symptoms of arthritis is swelling, pain, stiffness, decreased range of motion, and your symptoms will come and go. They can be mild, moderate, or severe, and they can remain the same for years and then all of a sudden progress. Now, there's no cure for arthritis, and it can cause permanent joint damage. Now, some of the joint damage that does occur as a result of arthritis is visible, and then other isn't. It can only be detected through x-rays. Now, the two most common forms of arthritis are osteoarthritis, which is considered OA, and then rheumatoid arthritis, which is often referred to as RA. Now, osteoarthritis is a degenerative arthritis, and some of the risk factors associated with it are excessive weight, a family history or genetics of arthritis, age, and then also a previous injury to a joint. Now, rheumatoid arthritis, or RA, is a chronic, progressive, inflammatory type of arthritis. It's a systemic disease, and it affects not only the joints, but the connective tissue and major organs. With RA, the immune system is compromised, so symptoms can go into remission for long times, and then they can suddenly reappear with exacerbation. The reason the major organs are affected is because the connective tissue is involved, and the connective tissue is connected with your blood vessels, your nerves, your kidneys, your heart, and your lungs. Now, if the body does not respond appropriately to the treatment of RA, it can result in death. Now, oftentimes the exacerbations of RA are a result of a physical or emotional stress. Now, researchers have also found and believe that genetics play a big part in rheumatoid arthritis, and also environmental factors such as smoking as a factor in triggering RA. So another reason to stop smoking. Now, there's another type of arthritis that maybe we have never really thought about it being arthritis, but it is, and it's gout. Gout is a metabolic form of arthritis. Now, gout is a result of the uric acid buildup in the body. Either your body is producing too much uric acid, or else your body cannot eliminate the uric acid fast enough. What happens is the uric acid forms crystals, these needle-like crystals in your joints, and it causes extreme pain. Now, the gout can come and go. It's very important that someone who has gout follows very much a pretty strict diet as far as avoiding alcohol or beer, high fructose foods such as corn syrups, shellfish, and organ meats. Now, treatment is very individualized based on the type of arthritis that you may have. That's why it's really important that you get an accurate diagnosis on the type of arthritis that you have, because not all joint pain is arthritis. Treatment can be as easy as a diet change, over-the-counter medications, or it can even go to more aggressive approaches such as drug therapy or even joint replacement. Now, the prognosis depends on the type of arthritis, the severity of the arthritis, and any complications that may occur with either organs or maybe joint related. Now, if you suspicion arthritis, you need to see your primary care doctor and begin a process of evaluation. You may be referred to a rheumatologist for further evaluation. The key, though, is diagnosis, following your treatment plan, and maintaining an ongoing evaluation with your medical provider. You know, my life's an open book, so I want to share with you my journey with osteoarthritis. I personally have a condition called erosive osteoarthritis, and it's similar to rheumatoid arthritis with joint deformity, and it's very similar. The treatment's very similar to rheumatoid arthritis. I see my medical provider, my PCP, every 6 months. I see my rheumatologist every 6 months. I am on a drug therapy plan with hydrochloroquine, and I know that probably sounds familiar because that was the drug that everyone was talking about when the pandemic started. And the other thing I do is I also see my eye physician every 6 months, because a lot of the medications that are associated with arthritis treatment can cause some damage to the eye. But all these things have helped me manage my condition. Now, for those of you who may be experiencing some kind of orthopedic pain or have a musculoskeletal condition, or you've had a related orthopedic surgery and you might be having some neck pain, back pain, head, shoulder, hip, or knee, you do have, through your health insurance program that's available to you, called the musculoskeletal program. It's designed to help you manage your condition. In order to get connected with this program, call your 1-800 number on the back of your insurance card, and you'll speak to a representative and they'll help you get enrolled in the program. I do encourage encourage you first, though, to see your PCP, your primary care doctor, and obtain a diagnosis to confirm your medical condition. The more info that we have, the more successful in guiding you through this program. Now, every week I like to share something with you, so I'm going to share a few things that I do, and this is strictly Nurse Cathy, that I do to help relieve the arthritis that I have in my hands. First thing I do is I have an exercise ball, and it helps with the strengthening of my grip. Because even with arthritis, you still want to keep moving, you still want to keep exercising. So I work a lot with a little exercise squeezy ball, where that helps me with my grip and strength. The other thing I like to do is I have these mitts, and these are ones that can go in the microwave. They're heated mitts. I got them at my spa. They're not only therapeutic for me, but they're also kind of a way to pamper myself. So this also helps during times when I'm having that inflammation to the joints. So these are really nice to get. And then the other thing that I do is I pamper myself with a paraffin spa dip. It's also very effective for me. Now, these things might not work for you, but it's a way to not only pamper myself, but also help treat my RA and as a comfort measure at home. So I just wanted to share that with you. And that's all for me today. Be sure to catch Ashley on Monday. She's going to be talking about hunger hormones and what they mean to you. So have a great weekend. Bye.